Welcome to the Golden Nest platform, your ultimate channel where you kickstart your day with positivity, well-being, wellness, health tips, and a lot of inspiration. I am your host, the Golden Nest. My mission is very simple, is to help you lead healthy, happier lifestyle. Please do well to subscribe and don't forget to ring on the notification bell below to stay updated on all our videos. Today, whenever we come on Golden Nest platform, it means we're going to educate ourselves and learn something new. On our topic today, we have Dr. Ethel Osei Tutu, obstetrician gynecologist, who is going to take us and walk us through the topic for today. Doc, welcome once again, and please introduce yourself and walk us through our topic.
Thank you. Thank you for having me again. I'm Dr. Ethel Osei Tutu. I'm an obstetrician gynecologist, basically specialized in women's health. Yes, so today's topic is on PID, or what we call pelvic inflammatory disease. So I'll just break it down. So it's an infection of the upper genitals of a woman. So when we refer to upper genitals, we're talking about the womb or the uterus, the fallopian tubes, or what we call the tubes that connects the womb to the ovaries. And the ovaries are the eggs. So any infection that affects all these things, one or all of these things, is what we call a pelvic inflammatory disease.
Thank you, Doc. Why is it important to know about it as women?
Okay, so it's because of the consequences of it. Sometimes most of the time it's asymptomatic. You may have no symptoms at all, but it would be causing harm. Sometimes the symptoms are very mild, so you may take it for granted. So it's the harm that can result from it. That's why we are proactively discussing it, because it causes a lot of problems. Yes.
Oh, okay. And what causes it, and how does it relate to our sexual, how does it relate to sexual transmitted infections? That is STI, as we call it.
Yes, okay. So because it's an infection, it's caused by an organism. And most of the time, the organisms are sexually transmitted infections, about 80% of the time. So 8 out of 10 times, you may have gonorrhea or chlamydia causing it. Other organisms contribute to the 20%, but most of the time it's these two that cause it.
Oh, okay. Are there specific age groups more risk to PID?
Yes, so the younger women, so I think they are more risk averse, they take more risk, and they may be a little
when
naive.
you say
So
younger women,
25,
okay.
25 years and less are more at risk, but they have to be sexually active to be able to get it. So there are other risk factors. You may be 25 or less, but not necessarily at risk. So having multiple partners, or you may have a partner, but the partner has multiple partners. So that also puts you at risk. Not using condoms also puts you at risk. If you've had previous PID before, the likelihood of getting it again is high. If you've had any procedures, like maybe a termination of pregnancy that's not done under sterile environments, you can also develop it. And douching. So some women tend to overwash their vagina. So ideally, you're not supposed to insert your fingers and wash the vagina, because you tend to introduce infections. The vagina is self-cleansing. It's able to cleanse itself. So you're not encouraged to put products and soaps and other things into the vagina in an attempt to clean it. You are rather introducing infection. So the infection may be there. The more you wash, it pushes it up. Okay. And then for some people who have an IUD in situ, it increases the risk a little bit, not too much, because there's already a foreign body, so any infection could also climb. Yes, so those are some other risk factors.
Yeah, Doc, you did mention putting things under there in the name of preparing it.
Personally, yeah.
Please explain that one because it's very popular and very common for the young people nowadays.
Okay, so as I said, the vagina is self-cleansing. It's able to clean itself naturally. It produces a discharge that cleanses the vagina. It comes out. When you menstruate, you don't have to now go and wash everything. It would come out naturally. Because the more you insert your fingers, insert products, soaps, and other things, you irritate the vagina and the cervix. And then if there's any infection hovering around, you are now pushing it further. So then that increases the chances of getting an infection spread into the upper genitals.
Okay. Doc, how long does it take for PID to develop after exposure to an infection? Can we see it immediately or it takes time?
So it depends. It depends on the organism. It depends on the virulence. That's how strong the organism is. So there's no fixed time, but you may not see it immediately. But it can develop anywhere from a day to several weeks, sometimes several months after even getting the infection. Sometimes you have the infection, but you don't even know. Yes, so it can take a while to develop.
And it means then that makes it dangerous if I have it and I don't know.
Exactly. It makes
Okay.
it dangerous because even though you can't feel it, it's causing
It's
harm.
called Yeah, okay. And what about the symptoms? Are they obvious for us to see?
Okay. So for sometimes, as I said, you may have no symptoms at all, but sometimes you may develop symptoms. So you may find a vaginal discharge that is abnormal for you. Every woman should know their normal vaginal discharge. At every point in their cycle, it changes. So knowing yours makes it easy to detect an abnormal one. So for the abnormal ones, they may be a lot, so that it may increase, the consistency may change, the color would look different. It may have an offensive smell. It may smell really bad. Then you'd know that you could have a PID or a vaginal discharge. Not all vaginal discharges are PIDs, by the way. But when it spreads upwards, then you're likely. So if you have a vaginal discharge, you have lower abdominal pain. Sometimes you have pain during sexual activity. You could also suspect a PID. You could also have a
About
fever.
itching? What about itching?
Itching, not necessarily. You may have a vaginal discharge, it could be candidiasis. That doesn't mean you have a PID. So not all discharges are PIDs. Yes, but you should also be aware if your discharge changes, just make sure that it's not a PID. So the only way you can do that is going to the hospital and having it checked out. Yes, so
Okay,
those are
so
some of the symptoms.
okay. Can PID be treated and can PID recur after treatment?
Yes, so PID can be treated. It's basically treated with antibiotics. Some women abuse antibiotics. Once they see a discharge, they take antibiotics, but that's not the solution because sometimes even taking antibiotics can increase a discharge.
That's
If
right.
you have candidiasis and you take antibiotics, you increase your risk of getting it. Like you kill the normal flora in the vagina, so the abnormal ones will now flourish and produce more discharge. So before you take antibiotics, make sure you go to your healthcare provider. So we treat the woman and we treat all her partners if possible. Otherwise, you will get it again because you are treating yourself. You go and have sex with your partner and then you get reinfected. Yes. So that's how it
So
can recur. Once you've had it before, you can have it again if it's not properly treated or if your
treated.
partner or partners are not treated.
And also, like you did mention, if you are if you are taking antibiotic on a wrong distance, you may also have it. So stop treating yourself. Contact a doctor. Very important message for us today. Thank you very much, Doc, as I can
So we
hear.
have to prevent it. That's even the major thing. You have to prevent it to even avoid treatment. So how would you prevent it? The usual ABCs. So
Yeah.
abstaining, being faithful to a faithful partner, using a condom, early detection, and avoid douching or inserting your fingers and things into your vagina.
So,
Basically,
Doc,
that's how to avoid it.
I want you to point on the more that those things we can do it ourselves. You know, you cannot control your partner not to go out there cheating, but you can do things for yourself. So I think that one you should educate us more on that.
Yeah, so that's what I've said. So one, abstaining, if you can abstain, and you be faithful to your
Mm-hmm.
partner. And then
Yes.
if you feel your partner is not faithful, use a condom. Yes. And then avoiding the douching and all of that could also reduce your risk.
Minimize. Yeah, reduce the risk. Okay. Does hormonal birth control affect the risk of developing PID?
So rather, it prevents, I think it decreases the risk because when you take the hormonal contraceptives, it forms a mucus plug to block the cervix so that the sperm cannot enter. So if sperm cannot enter, it's unlikely infection would also enter. So it reduces the risk slightly. It doesn't increase the risk. But behaviors that people take up, because they think they are taking contraceptives, they wouldn't use barrier said, that would also may also increase the risk. But the hormones in itself are a bit protective.
Oh, okay, thank you. You've already walked us through the prevention of PID, so we don't have to talk about it again. Doc, thank you very much. Our take home for today, what we can take home.
Okay, so the take home is be wary of the symptoms and then protect yourself. Prevention is better than cure. So try
Right.
to prevent it as much as possible and then detect it early. Once you have those symptoms, don't just go and buy any antibiotics and take. Go to a health provider because the antibiotics you have to take for a long time, for about 14 days. So when you are being treated, try to finish the antibiotics as required and then treat your partner so that you don't get reinfected. So that's my take-home message.
Thank you very much. Treat yourself, treat your partner so that you don't get it again, and consult a doctor always before you start treating yourself because it can turn into something else. Thank you very much. Doc, can you please give us a summary in three? Very short one.
Okay. Nti ɛnɛ yɛka infections a ɛfa mmaa ho awodeɛ no ne tubes no. Yɛka sɛ nneɛma a wobɛtumi de aprevent ne sɛ wobɛbɔ wo ho ban sɛ wo ne bɛrima nhyia a wonkonya saa infection no. Wo ne ne hyia so a try sɛ wobɛyɛ faithful wo ne mma different in that because ɛno nso increase your risk. Ana wobɛuse condom. Yɛnsa no a yɛde hyehyɛ yɛ ase try sɛ yɛde bɛhohoro yɛ ase no ɛno so doesn't help ɛmboa ɛno mmom ma infection ɛkɔ so. Nti woyɛ ɔbaa no ho sɛ wayɛ ase yɛ ɔyaa nsuo bi efi w'ase ba nka wo mu a ɛni kala asesa kɔ hospital na ɔmo nhwɛ adekoro nti a ɛkɔ sesa na ɔmo ma wo eduro so ɔmo bɛma wo partner so eduro no bi na ansa anyɛ wo bio. Nti ɛno na ɛnɛ yɛaka ho asɛm.
Dr. Edasi, thank you very much for honoring our invitation. Once again, we appreciate you and appreciate your time. Thank you for choosing to be part of the Golden S family. Together, we can create a world where our health is our first priority and wellness shines bright. Until next time, stay healthy and stay golden.